the question is how is this going to affect primary care? And I guess you could ask, well, how is Obama's stimulus package going to affect us? And the answer is, I don't know this time, because it really hasn't gone into effect. It kind of depends on what your market is, what's the supply of primary care, what are the insurances in the area, what's the unemployment in the area, what's the location, are you rural, urban, what are the healthcare facilities in the area, and also for primary care doctors, what is your access like, both from telephones or for appointments? If you look at national statistics, the average wait time for someone calling a PCP and getting in is 13 days. And the average for a retail-based clinic is 15 minutes. In Massachusetts, the percent of patients waiting greater than 1 week for a PCP appointment is 58%. So there's a huge backup. So patients are really going to follow the path of least resistance. The number of visits, 90% of the visits are the following diagnoses: URI, sinusitis, bronchitis, pharyngitis, some immunizations, otitis, UTI, conjunctivitis, blood pressure, or screening labs. So really very basic stuff. I do have, if you go to the website, you can read through some of the offerings that they have. There are some physical exams that they do offer at some of the sites. This represents about 13% of the adult PCP visits and about 30% of the PD visits. So I think it will have more of an effect on pediatrics. And then the surveys have shown about 15% of children and 19% of adults will likely use a retail-based clinic. The cost, the average cost per visit at a retail clinic is about $65, and in a PCP office it's about $85. Now in Minnesota, they have forgiven the copay, so that in Minnesota, patients who do use Minute clinics don't have to pay a copay when they go. A lot of the health plans feel that they've saved a significant amount of money by utilizing these retail-based clinics. At a recent seminar I went to, if you looked at the population of the United States and the number of primary care doctors, there are about 10,000 patients for every one primary care doctor. So there's a huge shortage of primary care. And the question is this going to fill in the void for primary care? Once again, I don't have a definite answer to this. It's really what we'll have to wait and see. One major concern I have is that there are several pharmaceutical drug companies that are looking at joint ventures with retail-based clinics. Right now, Pfizer and its Chantix drug is looking to work with smoking cessation with retail-based clinics, offering discounts on their medication, and also offering free phone calls every week after the patient starts their medication, and with a free follow-up a month after they start the medication. Another clinic offers educational material that is produced by a drug company but with no logo, but then the clinic makes available $5 coupons for those for that company's products. So I think that needs to be watched closely, particularly in Massachusetts. Several hospitals also have clinics. Aurora, which is down in the Illinois area, has Quick Care. Geisinger in Pennsylvania also has begun to form quick clinics. The estimates are that probably the Minute clinics every week will feed 0 to 15 new patients to primary care physicians in the community. So it is an access point to get people into the system, but the problem is who's going to take them in the system. But I really believe it is a good source for patients if you have a growing primary care practice that you really need the patients transferred over to your group. The other thing is when a patient touches your office, even if it's for a cold, a lot of times you get a chance to review the chart to see, gee, you know, you haven't been in for your colonoscopy that I scheduled, which you should have gone to. It's very difficult with certain patients to get them in unless they're sick. They don't want to come in for their routine health maintenance. And a cold visit or URI, conjunctivitis was an opportunity to kind of review their chart and get them in, plug in for, let's say, a mammogram or colonoscopy. Some patients, gee, while I have you here, let's just do a physical exam, really to get everything covered. So I think it's a lost opportunity if these visits are pulled out of the office. I think the other issue, and I cut this out of the Boston Globe, is a tough pill to swallow for CVS Caremark. It's a bitter pill to swallow, but CVS Caremark, the second largest U.S. drugstore chain, forecasts first quarter earnings less than analysts' estimates. I think that with the economy the way it is, a lot of these clinics are not going to open. I think the 2-year waiting time, the investment is going to be too costly for both the Walgreens and the CVS's of the world. So I'm a little less concerned. I don't think, considering the economy, that all of a sudden we're going to have 20 different minute clinics sitting in central Massachusetts.